Samir sir, please start. Please unmute and please.
Yes. So, namaskar, pranam, good evening, and welcome to all the guests today. Especially, we are very privileged to have the presence of Dr. Vasant Khalatkar, Dr. Neelam Mohan ma'am, Dr. Basavraj sir, all the office bearers of IAP, and all our respected past presidents who have joined. And I'm very delighted to welcome our president of Maharashtra Indian Academy of Pediatrics, Dr. Sanjay Pakmode sir. I'm Dr. Samir Dalwai, and I request Dr. Sanjay Pakmode to give the welcome address for this wonderful new program called Smart Pediatrician. Over to you, the President of Maharashtra IAP, Dr. Sanjay Pakmode, sir.
Thank you, Samir. Namaskar.
Namaskar.
Really, I'm very happy today to see so many people and so many stalwarts and the past president of CIAP have joined for the today's program. म्हणजे महाराष्ट्राचं भाग्यच की एवढे लोक सेशन सुरू व्हायच्या आधी जॉईन झालेत आणि त्यातही त्याच आंबेडकर सरांचं प्रेझेन्स म्हणजे म्हणावं लागेल की भीष्म पितामह पीडियाट्रिक्सचे आपण ज्यांना म्हणतो ते आज या प्रोग्रामला लागले. आणि मी नेहमीच स्वतःला हे समजतो की माझ्याही टेन्युअरमध्ये सर 2दा नागपूरला आले होते आणि परत आज एक CIAPच्या प्लॅटफॉर्म आपला एक MahaIAPच्या प्लॅटफॉर्मवर सर जॉईन करतात, ही खरंच भाग्याची गोष्ट. सो दिस पर्टिक्युलर प्रोग्राम because we are seeing the new leadership with the different. Now till date we are talking about only what is the pediatrician and the practice. Now here we have given different leadership which actually sees and want to identify the person in yourself as you and another person in you, or invent the new person in you, keeping your own identity as it is, at the same time, with the updates, with the technologies, with the changing social circumstances, and with the changing technologies, the changed you. This is a combination we want to make so that we will be able to live our life as a pediatrician to the fullest in such a circumstances where we are living right now in the world. So many things are happening. So keeping the practice and at the same time, after a few years, how to change your practice and getting adopted to the new ways of practice, but at the same time, keeping your hobbies, keeping your all the things. I mean, as normal other human beings who are not doctors, they are doing the things. So why not we only keeping an eye only on the practice? This is not a need of the hour. And our own Dr. Samir Dalwai, the presidential candidate from the Maharashtra, a very visionary person. Really, I can say the new leadership we find in him. And he has designed this particular program, a smart pediatrician with Samir Dalwai. It is his own idea where he wants smart pediatricians which are strategic, mindful, aware, resilient, and tech savvy. And it is his ideas, and with this idea, he came to the MahaIAP, and really we think it's such a good idea, and we thought we are really fortunate. We're having every Wednesday activity, a smart pediatrician with the Samir Dalwai. Here we got today, we got the Dr. K Amdekar sir, Dr. Santosh T Soans sir, another dynamic president of 2018. We have seen the wonderful leadership in him. And our own presidents, current president, Dr. Vasant Khalatkar sir, Dr. G.V. Basavaraja sir, and the president-elect 2025, Dr. Neelam Mohan. With these legions, we got this Dr. Indu Khosla madam, then Dr. Shalini Goel Agarwal madam, and Samir as a moderator, and also welcoming all the stalwarts of CIAP, MahaIAP who have joined today's programs, and all the office bearers and today's attendees who have joined in such a huge numbers. I welcome you all on this MahaIAP platform. And this is going to be a very good feast, a very different feast for you, all of you. Over to you, Samir.
Thank you so much, Dr. Sanjay, for your kind words. It's now my pleasure to invite our dear dynamic Dr. Amol Pawar, the Secretary General of Maharashtra IAP, for his quick comments.
Thank you, Samir sir. First of all, I welcome Dr. Amdekar sir, respected Amdekar sir, then Dr. Bodhankar sir, Dr. Santosh Soans sir, and current president Dr. Vasant Kaladkar sir, Neelam ma'am, Bodhankar sir, Basavaraja sir, and then Atanu Badra sir, our Yogesh Parikh sir, and all the office bearers of Maharashtra IAP as well as National IAP, all the executive board members of Indian Academy of Pediatrics, all the office bearers of Maharashtra district branches, and all the other our members of Indian Academy of Pediatrics from all over the zones. So this is very nice initiative. Already President sir has enlightened us about this, the concept behind this program, and also Samir Dalwai sir will again tell us what this smart pediatrician is. Everyone will get benefit of out of it, and they will get benefit in the form of they will get some inputs of which will be useful in their office practice. So I will not take much time and will hand over to Dr. Samir Dalwai sir for further proceeding. Thank you, sir.
Thank you so much, my dear Amol, for all the help that you have given. It's my proud privilege and pleasure to invite for the inaugural episode of Smart Pediatrician with Dr. Samir Dalwai, the President of Indian Academy of Pediatrics. Dr. Vasant Kaladkar has graced this occasion. Quickly, sir, we'd like to have your blessings. Over to Dr. Vasant Kaladkar, sir.
Good evening, all. Actually, I'm traveling. I thought it's a smart pediatrician project. That's why I wanted to become smart. That's why I'm coming in all t-shirts and all this. So, not in attire of a president. I want to be a smart pediatrician. That's my thing. So, whenever you want to become a smart, you have to adopt few things. That's new thing. You have to adopt you have to follow Dr. Amdekar also, and you have to follow Samir also, and then like Youngis like Amol also. That's the mainly crux. You have to, this is basically it's a grasping whatsoever you learn from your day to day, and now it's really a feast for us that we are getting from Samir and his team that how to become smart. Definitely, this is the era where all the IT people and all young generation they're coming to you, and you should have those the days old days has gone. Anyway, doctors how they live, how they nobody was bothered. It was only the how they treat. Now the treatment is 50%, and how you act smartly, that is very important. So thank you, Samir. Thank you, Amdekar sir, for joining, and all dignitaries, Dr. Neelam, Dr. Basavaraja, Dr. Yogesh, and Maharashtra IAP President, Secretary, and all past president. Thank you for joining. And I really am sorry I'm making it very short. I wish all the best. And if I will try to make this program nationwide. Thank you. Thank you.
Thank you so much, respected sir, for your kind words. I now request Dr. Neelam Mohan, our President-elect of 2025. Dr. Neelam is also going to be a panelist today, but just a quick word from her. Dr. Neelam, ma'am.
Samir, you rock, and I'm sure this program will rock, because sometimes I don't believe whether dreams can be transferred. This was my dream, which you snatched away. So we have common dreams. That's all I can say, because this was exactly always I wanted to do it, but I wanted to call it the Neelam Show.
This is your show,
Just
madam.
kidding. Just kidding. So best wishes. And I'm too excited to see what learnings we get from each other by being candid and sharing, so that the next generation is also able to learn and teach us as we move along.
Thank you so much, ma'am, for your kind words. And now it's my privilege to invite Dr. Basavaraj, our immediate past president. He was traveling, but I don't know whether he has been able to join. Dr. Amol, Dr. Basavaraj is here.
I am there.
Sorry. So it's our real proud privilege to have Dr. Basavaraj, who will give us his blessings on this occasion. Sir, it's over to you.
Thank you, Dr. Samir and MahaIAP, led by Dr. Sanjay Pakmode, Dr. Amul Pawar, and all the dignitaries. And of course, always the blessings from Central IAP, led by Dr. Vasant Kaladkarji, Dr. Neelamji, Yogesh, Dr. Atanu Badra, all. So it's a great initiative by me, the MahaIAP. It is one of the most sought program where I have interacted with many of the pediatricians across the India. So they are all looking for this show, led by none other than our teachers of teacher, Dr. K Amdekar sir, Dr. Santosh T Soans sir, and Uday Bodhankar, and all of them are here. So best wishes for the today's program. So looking forward to learn from legends. Thank you. Thank you very much.
Thank you so much, Dr. Basav, as always to the point and perfectly said. Thank you so much. My pleasure now to invite our Vice President, Dr. Of our West Zone, Dr. Bajania sir, for his blessings.
Good evening, Dr. Samir. First of all, let me congratulate you for this unique program, because when I was going through the title, Art, Science and Joy. So art and science, when these stalwarts are there, so obviously one can expect. But to have a best work-life relationship, the joy is very important. In fact, at our Udaipur Wisdom Pedicon, we had seen discussion in a session, and Dr. Amdekar sir was sitting in the front line, and after that also we had a one-to-one discussion. So I'm very sure that this program is going to be beneficial not only to the youngsters who just start their practice, but to persons who are into private practices as 30, 40, 50 years. It will definitely give them confidence, new scientific ideas, and of course, make them happy till they end their practice. So I congratulate Dr. Sanjay Pakumade, Dr. Amol Pawar for this wonderful initiative under the guidance of Dr. Samir. And my namaskar to Dr. Vasan sir, Dr. Neelam ma'am, Dr. Basav sir, Dr. Atanu Bhadra, Dr. Yogesh Parikh, and all the friends. And Dr. Uday Bodhankar sir, pranam. Thank you so much. Thank you.
Thank you so much for your brief and quick comments. My pleasure to invite our dear Honorary Secretary General of Indian Academy of Pediatrics, Dr. Professor Yogesh Parikh. Has Yogesh Bhai been able to join? Because again, he had a traveling issue.
He's joining soon. We'll take
Amol Bhai just point out to me, a message to me when he does.
Yes, sir. Yes,
I'm very happy to have our National Treasurer, Dr. Atanu Bhadra. Dr. Atanu, for your quick comments, please.
Yeah, Einstein had once said, don't listen to the person who has the answers. Listen to the person who has the questions. So today Samir has all the questions and we will be eager to listen to him. And for that, almost 500 persons across the country, dear friends, dear IAPians, had joined today. So Samir, you have the clear brain, you have the questions, you are eager to listen to it.
Thank you very much, Dr. Atanuda, for your kind comments. We have with us Joint Secretary from the Administration Office, Dr. Parmanand Nandankar. Dr. Parmanand, quick words from you, and then we go on to the actual discussion. We already have 440 guests waiting for us. So, Dr. Parmanand, pleasure to have you seen here.
Thanks, Samir. Good evening, respected sir, Vasankar sir, Neelam madam, the respected Amdekar sir, Bodhankar sir, Santosh T Soans sir. It is nice to see the great initiative by MahaIAP to start the smart pediatrician. We all in our day-to-day practice, we come across the clinical challenges in our life, but how to sustain, whether to like a solo practice or the group practice, how it is going to benefit to sustain for a longer duration, not for just a small period of time. And with this, we should continue our fitness and to get some extra ideas about it. And what a way to start, Samir, to get all the people together today and to learn from them, and looking forward to learn from all the stalwarts here. And I wish all the best to the MahaIAP and Samir for his future. Thanks. Thank you.
Arman, so sweet of you. Thank you so much.
Okay, sir, joined, sir. Yes.
Yeah. So we are very happy to have the presence of our dear respected Honorary Secretary General, Dr. Yogesh Parikh. Yogesh Bhai, over to you for your blessings.
Oh, thank you, Dr. Samir Dalwai ji, and thank you, Dr. Amol, for inviting. Heartiest congratulations to MahaIAP to start this wonderful program, Smart Pediatricians, along with our smart Dr. Samir Dalwai. So I think this is the best program. I will be happy to hear the art, science, and the joy of the success and the sustainable pediatric practice. So best practice for the solo and the group practice. What I heard a little bit from the doctor, our Parmanandji, or Joint Secretary Admin. So thank you very much, and the best wishes for program under our academic guru, Dr. K Amdekar sir, Dr. Santosh Soans sir, Dr. Neelam Mohan madam, Dr. Indu Khosla madam, and Dr. Shalini. We will get the benefit of their experience and expert knowledge, and we can have some good practice in our solo practice or the good practice. Thank you very much.
Thank you very much. Thank you very much, Yogesh bhai. You would make it today. So thank you, everybody. And
sir, quick comment from Bodhankar sir, please.
Yeah. So we are very happy to have the presence of our dear Dr. Bodhankar sir, our past president and a mentor to all of us. Quick comment from Dr. Bodhankar sir.
Hello. No.
Yes,
Yes,
sir.
Thank you, Dr. Samir, the respected Amdekar sir, Santosh Soans, Neelam Mohan, Vasan Khatkar, all HHG and all people. Samir, you are a smart person, and also Dr. Amdekar sir. So we definitely going to have a blaster master from Amdekar sir, Santosh Soans, and all people. My best wishes to you and all the speakers. Thank you for inviting me. Thank you, Samir.
Always
Yeah.
a very positive feeling from you, sir. Thank you so much. So kind of you.
Thank you.
Ladies and gentlemen, we are grateful to...
regard to MahaIAP patient executive and all the EBM.
Thank you so much, sir.
Okay.
Thank you. Take care of your health, sir. And it's a pleasure to have a plethora of dignitaries with us today. As we come to all of them, I'm just going to play a small clip here. Is the screen visible, friends?
Yes.
Yes, sir.
He prodded me like this.
All of us, if somebody's name brings a smile to our face, it is none other than Dr. Anand Chandelia. I just wanted to play a clip.
Just 2 years post MD, I started my own place in Jogeshwari East, which was considered to...
Is it audible, Yogesh bhai?
Yes.
Little bit louder. Put louder.
You're going to practice in Jogeshwari East, they said. I said yes. I disappeared for 8 years because there were a lot of issues which I was not aware about. Anyone who has set up a nursing home knows what I'm talking about. Basically, to put it simply, I learned what was not taught in a medical college. Everything else we had to learn. I thought I was going to become a consultant, someone, but then I realized I'm a consultant, ward boy, plumber, electrician, accountant. All these things came up at that same time. As time progressed, I became more and more isolated, stressed, bewildered, and I felt totally lost. The problem, it was around that something you need to do. The second problem which I faced was my patient would suddenly deteriorate. He was fine. He suddenly crashed. So there was something I was definitely missing. And I was stuck between two places, which were definitely very difficult to negotiate. It was around...
My dear friends, all my seniors, teachers, you will all be wondering, what is this program that we have got Smart Pediatrician? I'm sure all of us are smart, and I'm sure all of us are aware that we want to do well in life. We have the blessings of our teachers, our seniors, and our parents when we come out into practice. We do our best from school, from standard 10th, from 12th. After that, we go ahead and we then get admission in a prestigious institute. We study very, very hard. Parents are put through a lot of trouble for us. And at the end of the day, we pass and we come out. And the smartest, the most intelligent doctor comes out in this world, which is very, very different from what this person has experienced in the cocoon of a medical college with the comfort of all the seniors herding him or her around. And then suddenly you are faced with this, what you would say is a big bad world, and you are left to fend for yourself. How do I start a clinical practice? Do I start a group practice? Do I work under somebody? Do I work solo? Do I take a loan? Do I start a nursing home? Do I take insurance? Do I join IAP or IMA? All these questions are just on our minds all the time, and we don't know what to do about it. How do I go for a conference? What do I wear? How do I prepare for a presentation? Oh, some patient in my clinic is creating a trouble. How, do I know the art of negotiation? Oh, I am a lady pediatrician, and we all know the amount of bias and prejudice against them You get married, a couple of years, you put up your practice. Again, you have to leave after that. Then again, you have a child. You have to go away for a couple of years. 3-4 years into practice, the specialty has changed so fast that the lady has lost her confidence, and then maybe has to come back to the general pediatric practice. There are so many issues we face, and to deal with all of these issues and to find a kind of a solution, and if not a solution, at least a common voice, at least to define how we need to look ahead, we came up with this program, Smart Pediatrician, with Dr. Samir Dalwai, where SMART stands for strategic, mindful, aware, resilient, and tech savvy. And the idea is all of us know enough about fever, all of us know enough about antibiotics and cough, and our seniors, God bless them, are always there to teach us more about it. But who is to hold our hand and take us ahead step by step that we need to lead a happy life? We have parents at home, aging parents, we have young children, we have to a spouse, we have to bridge the gaps. And hence today I'm so happy and fulfilled that we are starting with the first episode of a show which I call Smart Pediatrician, and the title being The Art, the Science and Joy of a Successful but Sustainable Pediatric Practice, and what are the best practices that we can have. So going ahead, we are very happy to say that we have with us all the stalwarts today. And to begin with, none else than the great Dr. K Amdekar, my teacher to many of us, past president IAP, almost 6 decades of clinical practice, and as a teacher and mentor from Sir JJ Group of Hospitals, GMC. Then he did a great stint at the Wadi Hospital. We know him as the originator of Awesome Steer and Lessons from the Grand Rounds. Ladies and gentlemen, please welcome our dear darling teacher, Dr. K Amdekar, sir. Moving ahead, we have with us somebody who is my president of IAP, because when I became the EB in 2018, he was the president, and doctor, that's none other than Professor Dr. Santosh Soans, suave, erudite, sophisticated, always smart in a tuxedo. I call him the Amitabh Bachchan of IAP, but he's also an excellent intensivist, a very excellent teacher, and a very warm mentor. He is the innovator of Yuva programs, and he has come up with that term that I still remember as a young EB member, epidemic of academics. Dr. Santosh Soans, sir, always grateful to you and welcome to the show. We have with us a very dynamic lady, Professor Dr. Neelam Mohan, who is an eminent pediatric gastroenterologist and hepatologist. Many of us came to know about this topic from her. Over 35-40 years of experience, and teacher and mentor, trained herself in Hyderabad and then worked at Sir Gangaram Hospital, then is at Medanta. She is a BC Roy awardee, and she's also the president-elect of IAP 2025. She is here as an expert pediatrician to advise us about the way ahead. And we are very happy, madam, that you could change your schedule for us and be part of this. So ladies and gentlemen, please put your hands together and applaud Dr. Professor Neelam Mohan. We have with us somebody whom I grew up, or in my practice, really looking forward to emulate. And that lady's name is Dr. Indu Khosla. She has more than 4 decades of experience. She started with a small nursing home in Andheri, now pediatrician to the movers and shakers of Mumbai, Bollywood, and the economic commercial industry. She is an innovator because after a very good practice with a nursing home, with an NICU, IPCU, she branched off into pediatric pulmonology, sleep medicine. She has 2 boys who are international chess champions, manages her life phenomenally well, and we are going to learn from her today. Ladies and gentlemen, I'm also going to now put up a picture which I'm sure all of us should be very happy to see, because this is one of our younger colleagues, and I'm so proud that we got an opportunity to bring her on today. And I'm just one moment. Okay. Yeah, I'm just going to introduce her as a fitness person who has been an expert at fitness, keeps herself very fit. But the real thing that I would like to speak about her is that she started practice in a semi-urban area or a semi-rural area on the Delhi-Haryana border. And then she went ahead and she has been able to set up a very successful practice for herself. And when somebody recommended her to me for this show, I saw her on page 3 as somebody who has the combination of a great practice in a semi-urban, semi-rural area, and yet takes so much care about her fitness and the way she comes across. So ladies and gentlemen, thank you so much for participating with us. And we'll begin with now the youngest member of our team today, the youngest guest on the show, and that's none other than Dr. Shalini Goel Agarwal. Shalini ji, you are a lady pediatrician. You've done your MD, and you are very good at that. After that, you started private practice. What made you go to a semi-rural area? Tell us what were the challenges you faced as a lady, as a pediatrician, and tell us how you would advise our colleagues to be dealing with it in their life. Over to you.
Thank you so much, sir, Samir sir, and I'm really honored to be here with all the seniors, and huge respect to all of them from my side. To begin this, after doing my MD, I initially worked at certain Gangaram Hospital. Then I worked at a government hospital, Ambedkar Hospital. Then I switched to my practice as my husband was already working there in Narela. It's a suburb area at the Delhi-Haryana border. I was very excited but confused too, because I had worked in big hospitals, but private practice felt very different to all of this. The main dilemma of a lady pediatrician between work and family. We have to keep a balance between these two things. We had I had a small child that time. I was worried, can I mean, will I be able to manage my family as well as my child? There were so many cultural challenges, because from Delhi to Haryana, it's a border, and I have to face the totally different language. Narela people had different mindset and different kind of belief. I was not sure about that. Will they accept me or trust me? I was very confused. We had a small infrastructure, limited lab facility, emergency care, and there was a big change from big corporate hospital like Sir Gangaram Hospital setup to a small setup. That was really challenging. What I did during that time, I faced each challenge one at a time. With time and patience, I built my practice. Today, I feel this journey taught me more than any textbook. It's almost 23 years since I passed, 24 years, in fact, since I passed my MD. I passed from my MD from Ahmedabad, and I worked there at Gangaram Hospital. Neelam ma'am, I worked with her also. I don't think she's remembering those things. I worked with many. I worked with Dr. Chitkara as well, sir. Now, I won't take much time. I'll give some key messages to all young pediatric ladies who are coming forward to start their new setup. Just listen to me, these points very carefully. There is no perfect time to start a new setup. You grow by starting. Initially, there are so many challenges you have to face, but you should be resilient, should be motivated, you should be honest, commitment, and everything. What you need is you have to be strong, because you have to handle your family as well as your clinical practice. So you have to be strong. As a lady pediatrician, your ability to connect and multitasking and care, that makes you strong. You can succeed even in difficult areas. I'm sure about it. Thank you, sir.
Thank
I
you
think
so
over
much.
to Dr. Samir.
Thank you so much. The key points: face challenges, and there is no perfect time to start. You grow by starting, and I absolutely agree with you. Nothing succeeds like success in the face of resilience against all odds. So great show. I am now coming to our senior most, our guide and mentor, Dr. Amdekar sir. Sir, you just heard Dr. Shalini Goel. This is her story from 20 years back. Now we have so many pediatricians passing out and starting now. You have started way back. What were the challenges at that time? And my question to you is, how have these parameters changed for the pediatrician who's starting today?
I think I started my practice in mid-60s, when the whole era was so different and very, very helpful too. I thought the challenges are always at the two extremes, one at our family and personal level, and at the professional level. I was lucky to have been born and brought up in a very large family where, when I started practice, I was with 4 generations in the same house. My children my parents, my uncle and aunt, and my grandmother. With 4 generations staying together, there was a lot of understanding. And I think at my personal level, I had no challenge whatsoever because I was assured of food and shelter. And then when I started practice, I had to decide what challenges can come up and how I will overcome them. The first and the foremost, thanks to my teachers, I was lucky to have worked for about 2 months with the father of pediatrics of this country, Dr. George Goel, who started the first pediatric hospital in 1928. And that's the hospital I was trained with. And he used to come as a professor of emeritus. In a year's time, Dr. Sansgiri, the next pediatrician, started a BJ Wadia hospital, and I also got to learn from him. And what I learned was far more than science, the art. So when I started practice, the challenges were very few. And the reason was that I had patience to wait for my patients to come to me. There were several months to begin with when I went home without seeing a patient, and I was happy that I could get home fast. I could be with my family much earlier. Thereafter, I find the practice building up. I was also happy because I was earning more money, though I was going home late. This happened in the first 10 years, and I realized that the challenge is how you set up your vision, how you set up your mission, and how you set up your goals to make your vision and mission come true. And my mission was simple: wait ethically, try to do best to even an occasional patient who comes, who should then realize that, well, this man looks to be a little different. He's not in a hurry. He's ready to answer all silly questions. And I think that made a lot of difference. And that challenge very soon disappeared. But one challenge remained. I could not afford my own clinic. You will not believe, for a good 40 years of my practice, I was always hiring a place, and the place did not give me a lot of time, so I would move to another place. Till such time, 20 years ago, for the first time in my life, I owned my clinic. But that was not really a challenge because I was peaceful. But in the first 10 years of spending more than half a day at the Grand Medical College and JJ Hospital teaching, where I was getting 100 rupees per month as an honorarium from the government. But there was a lot to learn. And then within 8-10 years, as the practice built up, I realized that's the time to maintain quality, and I must have another person working with me, not as an assistant, but as an equal partner. And I'm lucky that every 10 years I got one of my old students to come to me and join me. And today we have 4 practicing in the same premises, sharing patients, sharing the seriousness of patients, talking, seeing everybody's problem patient, and the patients are happy that 3-4 heads come together and the charge is only for one consultation. This has given me a lot of time in life. I gradually weaned off my practice. Today I see patients twice a week only for second opinion. I have a lot of time to enjoy what I want. And friends, I'll end up by saying that we need to have a clear vision of what you want to be in life. Just because we exist, the life is not worth. And therefore, we have to decide. And when we started practice, we had enough time, we had enough energy, but we did not have enough money. Then the time came when the practice built up. You had enough money, you had enough energy, but you had no time. What a pity. And at the fag end of my life, I have enough time, I have enough money, I must maintain my health and have good energy. And at the age of completing 84, I am very active, hopefully mentally, may not be physically very much, but I keep updated, I keep on teaching. And I think this is possible only because my vision was clear. And the vision was not success, the vision was happiness. And I believe that success lies in happiness. And what is success? Success is what others see about me. But what is happiness? Happiness is what I perceive. And I give a lot of weightage to that. Even today, I don't have a large practice. In fact, we share practice. But I tell you, there is a lot of happiness. And happiness is something that you can share with everyone. It does not vanish. It gets more and more further developed. I feel that's the way. But one change that has occurred, at that time we used to depend on the general practitioner sending us patients. And then even at that time, early 70s, a cut practice had started in the metros in Mumbai and Delhi maybe. But today, we are lucky. Patients come to us as general practitioners. Today, hardly any affording parent goes to a general practitioner. They come straight to a pediatrician. But I feel pediatrician must behave not just as a general practitioner, but a general practice at a higher level. And what is that higher level? Look at nutrition, look at growth, look at behavior, look at every small thing, not just for a disease that they come. If you keep this vision, I think there is no challenge. I end up saying that no doctor, forget pediatrician, we are highly qualified, is starving. We all get enough money. The problem is what is enough? And let's decide for ourselves what is enough for each one of us. Thank you very much, Samir, for this opportunity.
Thank you. Thank you so much, sir. Thank you so much. Your words always. So I like in the words of William Wordsworth, what is this life if full of care? We have no time to stand and stare. And of course, like what you said, I think what Mahatma Gandhi said, that there is enough in this world for everybody's need, for not enough for even one man's greed. So I think wonderful lessons. I'm going to take a quick comment from now Dr. Professor Santosh Soans, sir. Sir, one thing that all our youngsters and so many even who are middle, your 15 years of practice are saying that, is there a place anymore for general pediatricians like Dr. Amdekar sir was saying, or is it now all specialist era? And you, how do we go ahead with this single practice or group practice in today's time? Over to you, Dr. Santosh Soans, sir.
Some time back, I was just looking at a newspaper. There was an advertisement for pediatricians wanted in Saudi Arabia. Just as interest, I just looked at it. They said they wanted a pediatric nephrologist, neurologist, cardiologist, all that. But there was not a single advertisement for the pediatrician. So it kept sort of wondering what happened to the poor pediatrician. Now what is happening is when we came back, because the major this thing, like I joined in around 90s, the mid 90s for the practice. Initially, I was in a medical college, then went abroad, then came back after 4 years. Then I started my practice. So that's a time when we had seen outside, they were having this group practice. So what we thought was a group of pediatricians, we thought we'll start a practice, but initially the OPD practice was still in the nascent stage. We thought we'll have a PICU and an NICU in a separate hospital. Then we started that. But the problem, what I thought was having that thing, it is very important for the senior most person to be non-egoic. If he becomes egoistic, that juniors getting more patients or this type of group practice is bound to fail. Of course, when you have a single practice, what happens? There is more autonomy in this thing. You can decide what you want to do, and you have a direct control on all the patient care. So basically, what we did was we were taking calls on a single day, that each one was called all that thing. But somehow, at the end of this thing, I'm not blaming anybody. The senior most person was little more this thing when the junior started coming up, having more practice was having. So our group practice actually failed after about 4 to 5 years. Then we went on to do a single practice. It's going on. There is no problem. And I'm in the mornings, I do my college work. I'm in the college. Afternoon, I have my own private practice and I do a solo this thing. But if you have a group of like-minded people, because I can see whether in Nagpur, when I went there, they have their hospitals built together with so many pediatricians. So it is working well in many, many, many places, because end of the day, as our sir has said, it is that what you want in life, because you can have a lot of time for yourself and otherwise every night, especially at the younger age, is a ordeal. In fact, I said, I was doing some neonatal practice initially, and so many calls at night. So I was staying in a flat. So I had to disturb the watchman so often. One day he got fed up and he locked the gate. I had to keep my car upside and jump over the wall and get into my flat. So these were the days when it is there. I think the time has come for us all not to sort of go on a solo. It becomes much easier with the group practice. And also what I say, see, our generation, which is a little the newer generation, what happens is when they get a case, like for example, febrile convulsion, without thinking what to do, they tend to refer it to pediatric neurologists. At least they should be able to sort of examine, properly treat a simple febrile seizures by themselves, not just like a traffic light, you just tell them you go here and all that. So this is what is happening in the present day. What is the thing? Thank you.
Thank you so much. I think the message is very clear. Just going by group or solo doesn't help. You have to have a plan. Like you said, Dr. Amdekar said, what is your aim? How do you set about doing it? And then you need to work on it. Somebody once said that relationships, and Amdekar sir, I would like you to also know, the friend of mine, a movie called Ventilator. He said, Nati, he daat brush karण्यासारखी असतात. Means the relationships are like brushing teeth. How? You have to do it every day. So you have to be careful, and अपन मराठीत म्हणतो जपणं जपायला लागतं. You have to be careful. आपके रिश्तों के बारे में आपको रोज ख्याल रखना पड़ता है. So that's what's the secret to group practice, I definitely think. Moving ahead, now we have Dr. Neelam. Now all of us know Dr. Neelam as one of the pioneers of practice in terms of gastroenterology, hepatology, such a difficult branch. You need a big support system for that. Not possible to start on your own. Yet she is individually known as a teacher and has been all. So Dr. Neelam, one question is, how do you choose the location? Is it important to start in a known place, in a busy metropolis with many doctors, or you go to a smaller place? Does your choice of the field that you choose influence that? And as you speak, let me say that we are very happy to have touched 500, but I apologize because any more of our colleagues may not be able to join. If they are asking you, please tell them, direct them to the YouTube site, they can join. So Dr. Neelam, you have a crowd of 500. And the question is, how do you decide where you set up your practice depending on the field of your choice? Over to you. You unmute yourself, madam.
Yeah.
Yes.
So I think definitely depending on the time, your place would matter. For example, when I started, I wanted to do pediatric hepatology and liver transplantation. It was just not possible to do something like that in a small place. However, there is a change. You know, the same thing what I started my practice in 2000, 99 and 2000. That's the time I started. From then to now, you are seeing a lot of change. You are able to develop gastroenterology, hepatology, even in smaller places, except liver transplant. So you have to decide what exactly you want to do when you want to choose your place, number one, as Shalini was saying that. But in her case, she was a pediatrician. So from a pediatrician point of view, I would think that there are two aspects of it. Is it possible for you to pin me, Samir, because I'm not able to see myself. I'm able to see only Shalini on the screen. So when you are in a metropolitan metro city, then obviously your competition is intense. So you have advanced diagnostic, super specialist referral, patient volume, all that is there. But the advantage in a smaller town, is that the pediatrician is almost like a king in that small place because he or she is able to gain that trust of the patients quickly. They're able to build deeper relationships. And though the infrastructure is limited, that is one they talk about. But to me, I think success is not where you are, but also how committed you are to your work. So there are so many ways of definition of success. One, Dr. Amdekar said, success is what your colleagues perceive of you. But at the same time, if you go into deeper definitions of success, success is achieving the goals what you've set for yourself. The goal could be anything. The goal could be having a good practice. It could be developing a specialty. It could be giving back to the society. It could be having your children get into IT, or it could be living someone's dream. My goal was to live someone's dream, and that was my favorite, my father. So it was his dream that I should become a doctor and set up something new which did not exist in the country and get an award from the president. So I grew up with a dream right from childhood, like that movie Lame, where Sridevi grew up with a dream, ek Rajkumar aa jayega, le jayega. So that sort of a dream I grew up with. So for everybody, you need to prioritize, and there is nothing wrong in having your success which says, I want to be a great family with some amount of work. So absolutely every individual is different. So based on what you want, what your goal is, what you want to prioritize to your success, then you can choose. And as I said, there are advantages and disadvantages both in a metro as well as small place. You've seen such a great pediatricians who in the small place are doing so amazingly well and much more popular than the people in metros. But ultimately, I think that your excellence travels. The patients will find you if you provide them quality and ethical care. To me, these were extremely important, that I give quality and ethical care.
Thank you so much, madam, for your words. It's very important for everybody to understand whatever you may want to do. You have to have a dream. You have to have a passion. You have to nurture your dream and your passion. There's a wonderful movie called The Pursuit of Happiness. Will Smith, you must watch it. And then with that passion, you need to get yourself that training, the qualification that Dr. Neelam got, and then pursue your dream. It doesn't matter eventually where you are, because if you are good, people will sort you out. And that's exactly what happened with Dr. Indu Khosla, because she started off on her own, no godfather, on her own. She started with a very small, we have these small tiny flats in Mumbai, 1 BHK. So Dr. Indu, tell us about your journey, but more than that, what we would like you to tell us, to our friends, is there any point in even considering starting your own nursing home these days? There's so much of competition from others, competition from the corporate sector, so many medical legal issues, financial issues, insurance issues. Would you advise our people to start their own nursing home today?
Thank you, Samir, for giving this opportunity. It's a rare opportunity. Nobody asks us to speak about these aspects of our life. And I think even sitting on this platform, I've learned from each of the speakers who've spoken before me. I started my journey small, but it was my passion to do what I did. And I had the support of a lot of people, especially my family, behind it. And I don't think for a woman, it is possible unless the family supports you, because we have to do a lot of balancing. And I think less said about it, the better, but it is a lot of balancing. That your question is whether we should have a nursing home or not. So in the era that I started, having a nursing home gave me an identity. Having a nursing home gave my patients a 24-hour availability to come to a center if they needed help. Having a nursing home was a necessity in those times because we didn't have corporate hospitals. So we didn't have any job. So either we do OPD practice or we are in government hospitals. And in those days, the government hospitals had, I think Dr. Amdekar, of course, the teacher, and he was at JJ. But there were a lot of, I mean, it also depends on what you want. So in a government hospital, there was much more to desire. It's good for teaching. It is good for learning. But if you wanted to just get into more into, into practice or into many other aspects of practice, maybe there was lots to desire in the government hospitals in those days. Today, our government hospitals are excellent. Post-COVID, there is every facility, every ventilator that you need that is there, and every research is happening, everything is happening. And in those days, neither was it financially remunerating. When I started, I had no resources. I'm the first doctor in the family, excepting my husband though. I mean, I have absolutely no resources. So we started from scratch. We had a bank loan. What I earned, we paid back the EMI. That's how I started. But what I think is, if you're passionate about something and if you're honest about something, everything else is secondary. And the other thing which I've learned is from teachers. I was fortunate to have Dr. Lokeshwar as my mentor, and I was fortunate to have Dr. Fernandez as my mentor, and then later on Dr. Raju Kupchandani. I was unfortunate not to be with Dr. Amdekar ever, and that's my loss for life. But these three people taught me a lot. So Dr. Fernandez taught me to have a vision ahead and then to work backwards, right? So my first vision was a nursing home. My vision is when I retire, I should be known for my social causes. So I've taken that ahead. So I think we all need to think 10 years later what you want and then work backwards. The second thing I learned from Dr. Lokeshwar is to work with people together. So that taught me group practice. I am in group practice for more than 30 years now.
Wonderful.
And see, there are no two human beings think alike. No two, even twins don't think alike. But we have to learn to let go. And that learning to let go has kept my team. We are 5 pediatricians today.
Amazing.
But it is a financial burden. I need to tell you this too. So when you talk about nursing homes today, if in a city like Mumbai, you start a nursing home, you want to give good quality care, which I will die if I don't give good quality care. And so you need to put good staff, you need to put good doctors. It is a big financial burden especially for pediatric nursing homes. So I think people of today have lot of avenues. So they have to think what quality of life they want, and then they can take forward. The other thing I learned from Dr. Kupchandani, another mentor of mine, when I changed direction to pulmonology, he says, as Dr. Soan said, that people are asking for only super specialists. So Dr. Kupchandani told me, after so many years of doing pediatrics, maybe you will get fatigued. Maybe 10 years from now, you will want to do something different, and the era will change. So he, in 2006, pushed me to pulmonology. Then I trained myself. There was no courses in those time. So that's another thing I want to tell is keep learning and keep changing. That is to be constant if you want to maintain quality. So be passionate what you want to do. I don't think ever in my life I've run after money. If you do good work, money follows you. People recognize you. People recognize you for what you think. And one very important thing I would love to, relate with people of this generation is the art of communication with a patient. When a patient walks into my chamber, I'd see the child with the side of my eye because to understand what is the problem of the child, is he critically sick or not. But my first eye is on the parents. My first eye is on what the parents want. And that is very, because the mother of the child is your first person important who will tell you what the child has, because she sees the child 24 hours. So to answer your question, should we have a nursing home today? It again depends on where you are.
Absolutely. So, yeah,
like
go
ahead. It is difficult. The compliances, requirement of government, the municipality, and the availability of other centers which are giving good care. And if you're a small sized, it is going to be difficult to meet timing. But
So,
if you're free, it still makes sense. It still makes sense.
Perfect. So I'd like to tell all our guests today that we are having a separate episode on what are the financials, what are the permissions required to set up your own nursing home in different parts of the country. There's an episode on that, and there's an episode on how to take loans for it. And also there's an episode how to decide between corporate job and a government job or a solo practice. So keep watching us every Wednesday. After the first round of questions, I'd like to come back to Dr. Amdekar now, and we'd like to keep the answers to the bit more concise. Sir, how does one survive and enjoy among growing number of pediatricians or amongst competition? Survive bhi karna hai aur enjoy bhi karna hai. Dr. Amdekar, sir.
I think today's era is in fact very favorable for enjoying work. The reason is an affordable patient is directly coming to you and me as a pediatrician. There is no general practitioner in between majority of the times. So you have a competition with several pediatricians, but the entire community wants to go straight to a pediatrician. But my concern is, are we doing a job better than an average general practitioner, a family physician, or we are now gone down to their level? And I think that's a challenge for all of us. It's good that the patients come directly to us, so there is no mediator in between. However, the responsibility that the patient coming to you directly gives you an opportunity, but also a responsibility of doing something more. And I'm sorry to say that not 5% of OPD practice in pediatricians have a growth chart also. Are we then a consultant? Are we a specialist MDs? No, we don't behave like MDs. We behave like quacks. When a patient comes to you, do you really advise on every other aspect that the parents don't know, that you owe that to them, but you just look at what they want you to look at and then just pass off? I'm sure every good consultation takes 15-20 minutes minimum. And I've had my own students who say, sir, आज सेंचुरी लगाया. मैं बोला कभी से क्रिकेट खेलता है? सर आप समझा नहीं, आज 100 पेशेंट देखा. I tried to calculate and I realized that he gave not even 5 minutes to each patient, which means he did not have to say, please come and sit. You just start saying, jaldi batao kya hota hai, aur chahiye jaldi le lo, payment and go back. Is that the quality? And therefore, I would just feel that competition is no problem today at all because we have large population. And if you do a good work, people are looking for a good pediatrician who spends time, who counsels, who communicates, who puts the growth chart, who advises on nutrition without asking for it. And I think, I imagine maybe 10% of pediatricians find time to do all that. 90% don't. So good people in the community will understand this 10%. And if you are ethical, you spend time, then you will have far more practice. I'll end up by saying that patients don't care what you know or how much you know, but they want to know how much you care. And are we giving care or are we only treating diseases? And now people even have started teaching at diseases. No, we treat the numbers, investigations. And I think the educated patient understand all this. And about the generalist and super specialist, today as a senior general pediatrician, I see patients having seen super specialists. Why do they come to me? They know I know much less than what their super specialists know. But they say, sir, उन्होंने कुछ समझाया भी नहीं.
Yes.
Now, you understand that communication and counseling, the art of medicine, is far more important than mere science. And the reason? Science is never complete. Even today with all advances, we are short of cure for majority of diseases. But the art that has come from a traditional wisdom has never disappeared. In fact, we have forgotten it, but the patients want it. That's what I would say. That's where we should do well.
I think the message is very clear. The competition is not in terms of the knowledge of pediatrics in the textbooks that you have, but you can score over the competition by being more receptive. But sometimes, Dr. Neelam, we have patients who are very anxious, who are very worried, especially if you are practicing in a branch which is very difficult like yours, or in a rural area where you don't have all the facilities and the child suddenly deteriorates. How do you handle anxious patients? Dr. Neelam?
I think books are my best friends, probably. I would confess that I was very short tempered when I was young, and probably I realized that even the best when I did, I would find, like Dr. Amdekar said, the patient was upset not with the care, but maybe much time. So that I realized, and I think, as I said, then there is a lot about me which is positive. When I say positive, I believe in the affirmation theory, and I believe in those so much. Rhonda Byrne being my favorite with her book Secret, that it changed my perspective, and I end up actually emotionally and talking to the parents that what we think is going to happen, and you won't believe this really works because I sit with them hand in hand now. because I deal with liver failures, liver transplants, chronic, quite a lot in the inpatient care. Of course, the outpatient is predominantly GI, but then they realize that at the end of the day, it's empathy that really matters, which Dr. Amdekar was emphasizing, and probably few things which should always remember that my mentor when I did pediatrics was Dr. Arya, who was at same age around Dr. Amdekar, and they were friends. So one, they at least he believed that there was no age, there was nothing short of learning. So he would always, even when I was a resident, he would ask, Shori Neelam, what are your thoughts? So that, the aspect of learning all the time makes you perform better. And I guess the reputation that I eventually ended up gaining in the patients I was always honest, transparent, and yet very empathetic, because this I realized, and I help them a lot in various ways, whether it is collecting finance through, my friends, my husband, and CSR, whatever. So these are the various ways that I talk to the patients when they are anxious, because the anxiety in parents is twofold. One is what is going to be outcome, morbidity and mortality, and second is finances. So
Absolutely.
you need to address both at that time. And the one thing they are confident is she's going to do the best. So once they know that she's going to do the best, and I believe in that karma with a huge painting of Krishna right in front of me, which I say that yes, I'm doing my karma, you're doing your karma, and I'm sure fal we are going to get. And if we think positive, we are going to get positive. So these are the ways I do in my communication.
Absolutely. So it's about the empathy, and patients are anxious both about the outcome as well as the finances. So we'll come to handling patients in a poor or a resource crunch area. Dr. Shalini, before that, I want to go to Dr. Santosh Soans, sir. So at the same time, we sometimes get patients who are from the politicians' families or from very rich families. And, I've seen your clinic in Mangalore, and people might come and try to, be I'm the MP or so and so forth. Now, all of our youngsters at least feel this problem sometimes. How do you deal with these chaps? Unmute yourself, sir. Please unmute your microphone.
See, I think all of us have gone through this problem of VIP, culture of VIP patients who think they are VIP and they can sort of barge into your clinic, and as soon as they come, they want to sort of to be seen by you at the earliest. Basically, what I'll do is I'll just tell my receptionist this person is coming, just enter, because they would phone you or something like that. That would be the thing, so that at least keep their name in the list of waiting list as such. And always, if you are nice to them and tell them what it is, and don't give them too much of a rope that they are some great people or something, like talk naturally to them, and whatever questions they want to ask you, tell them that, because trying to overtreat or undertreat also is going to be a problem, especially admitted patients. We have many of them coming to the PICUs where we need to do a lumbar puncture. Those days there were a lot of meningitis. They just be a problem, because we would think like how to tell him whether he'll allow it or not. He'll say no, you take to some other, want to take to the other hospitals and all. But you tell the truth and you tell what this is my findings, I would like to do it. It's much easier to handle these VAP patients.
Absolutely. Dr. Neelam, Dr. Indu, any of your Finstar patients you want to share with us?
So it is no point. I will not take names, but I can tell you.
Everybody wants to hear the names. What's a Finstar without a name?
Very good.
No. So I cannot speak negative on a platform like this. I'm sorry about that. But then the thing is that, there are different types of people, and there are some who are very humble. So I can take that name. So Arijit comes to my clinic. But
Arijit Singh, the singer.
Arijit Singh, the singer. So the first time he came, he waited outside like a normal person. Unfortunately, nobody recognized him. because he dresses a normal person, right? And he waited in the queue and he came and sat in the queue, and I also did not recognize him. And he went away. And we treated him and he went. The next time he came, my staff recognized him. Then they made him skip the queue, but very quiet. So hats off to such people. They are humble. On the other hand, I will not name, a person who comes in, she walks in, even if I'm seeing a patient, she doesn't care a damn outside corner. And she will walk in, she'll sit down, and while I'm talking to the other patient, she will start giving her advice as well. Kine, you can do like this is better. So they're all types.
So all those of you who think
And
that it's very
Samir,
nice
I
to
would
have
also
Bollywood
say,
patients, it's not a good idea. Sorry.
No,
in Delhi, we get politicians more. So more than the Bollywood, we get politicians. But I had a very embarrassing time, let me confess. Sonia Gandhi had brought her grandchild, and I, as a dumb person, asked, "How's the stool of the child?" Because there was pain abdomen. She looked at me thinking, "Do you expect me to look at the poo?"
Yeah.
So,
So after 2 minutes, it took me to think, what did I ask? And then she had to call the nanny and whatever. But sometimes, you just treat normally, but she did not actually say anything. She just gave her hand. So they are some of the politicians who were very senior are extremely humble. And the one who came from Bihar, they are great because they will make you a call to आते साथी पहले phone देके डॉक्टर साहब आप इनसे बात करिए, like they are those types also.
I think all of it requires a little bit of patience without.
I agree with Dr. Soans. Actually, most of them will call you. Okay, I prefer they don't come to the clinic because they actually disrupt the clinic. So I say, okay, if they want a home visit, I would go and do a home visit. I tried not to even do that because I tried to even give them free advice. I'm okay with that. And the other thing is when they come, no, if you have a place in your clinic to make them sit separately and and not disrupt, that becomes much easier for youngsters who are handling these VVIPs. All they need is a little importance. So you make them sit separately, maybe offer them a cup of coffee. They will be quite calmer, and you can definitely go and handle them much better. The only problem I see, Samir, in handling these VIPs, we cannot afford to make a mistake handling any patient, whether the poor or the rich. But these people, sometimes we feel overwhelmed when we are handling such VIPs, and we have to be very careful not to make a mistake here. So that's very
Absolutely.
message.
I think the VIP is also very worried about his own patient. So it goes both ways. But Dr. Shalini, you are practicing in a semi-urban, semi-rural area. How do you manage patients who are not affording? Can you tell us quickly what is your way?
Yes, sir. Actually, I'm seeing a lot of such crowd along with the good patients. I mean, hi-fi patients. But the thing is, whenever you see a patient, just keep your eyes open first. Identify if the patient is genuinely poor or not. Give equal importance to both type of patients, either rich or poor. Don't differentiate, and let them sit first in your clinical setting, and ask properly, and then keeps your eyes open, and then give equal respect to all these patients as well. And first way I used to help them, either I tell my receptionist, if I see a patient poor, I'll either give some discount on my consultation fees. I used to give free samples to them, and tell them, use these medicines whenever and you want it. You come back to me, you send me a message or talk to receptionist, I'll arrange further. These are the thing I can do. And if I am admitting any patient, right now I'm not admitting, I'm keeping any patient in daycare. Whatever the expenses from the hospital, only I used to take that. Otherwise, I try my best to help them.
So that's the whole idea, is the approach. So how does I'm just coming to another question now. You've been in practice for a few years, and now, how do you manage this balance between academics and a very, very busy clinical practice? Like, you've done all the things, all the advice given, you've got a very busy practice. So I'd like to ask Dr. Soans, maybe Dr. Indu and Dr. Neelam also after that. How do you, as a pediatrician, manage academics along with busy practice?
I think it's all in the interest what you have to do, because I've been doing a regular this thing, because always keep time for each this thing, because morning I get up, I go for my swim and gym, and then go to the college, and I have my timings 9 to 11. But when you start your practice, this is for the youngsters. We all want to make an impact. We want to have as much as patients as possible. Your OPD will go on till, we want to continue till 11. We want to prove that we are the best. We want to have the maximum patients and treat everything possible. So that's the time when you start your practice. As you get your practice to a certain level, then the trajectory comes. No, that's the time, 10 years, because possibly from 35 to 50 is the time when you sort of forget your exercise, forget your family, forget your social contacts, this thing. This is the time when, then slowly after about around 50, 48, 50 is the time when you again realize what I've been doing. Whereas we want to go and meet people. And so, because I've been in all the like Freemason, Rotary, I used to spend time, give some time to them, because if you want to do, you can always spend time with these different this thing, because it's very important for our lifestyle, that make sure, especially the activity physically or sports or exercise is very important, and also your social connect also, because what happens is, if you forget your old friends, because what happens when you really need them, because by 60 they also will be busy with somebody else. Even if you want to connect with them, they're not interested in you. So it's very important that you keep the connect. Spend maybe Sunday, I'm not going to do anything except sort of spend time with my old friends, my family, all that. You have to make sure that give that time for them. So this is very important for the young generation who are coming in.
Thank you. Thank you so much, sir. Dr. Shalini, how do you manage this fitness thing? How would you tell our pediatricians in a quick way, in a few minutes every day, how can they keep fit?
So first of all, the thing is that every woman, I'm giving message to all women, they strongly need fitness, because they have to take care of their family, their parents, and obviously husband. Fitness is the thing you have to keep in mind. Just spend 1 hour daily. कहीं से भी time निकालना है, लेकिन निकालना जरूर है. 1 hour. Either you do Pilates, you do yoga, walking, brisk walking, or strength training. I would say strength training is the best thing a person can do, especially the women of my age, or maybe earlier. If you start earlier, definitely have good bones, strong muscle mass. That will definitely help in your future. You have to see a lot of things. You have to be multitasking. That's what I can say. You have to spare 1 hour at least from your busy schedule.
So it's cardio maybe every day, but it's also strength training, doing weights
Yes.
2 days a week. So that's a great message. Also, Dr. Indu, how do you build in time for academics in a very, very busy practice? Because you've been publishing so much, you've now gone into a super specialty as well. How did you manage academics in your earlier part of your practice? And then maybe Amdekar sir can tell us about how do you find the role for IAP in your busy clinical practice? Dr. Indu.
It's quite a challenge, and I think it's a very big challenge for women. And I love the way Dr. Soans summarized it, and I love the way Shalini told it's very important for women to exercise, or anybody to exercise. You should take out time for yourself also. So what I do is, I think we should delegate work. And when you delegate work, the other person may not do it as you may want to do it, or you would do it, but learn to accept. So you may have to delegate work for at a certain level of acceptance of yours, that which you need to increase. You can improvise on it, but if you delegate work, it will be good. Secondly, teach. The more, if you may not read like this. So when you have to teach, you have to read. So when you teach, you learn. So, and if you have good students around you, they are your best teachers. So that's the way also I learn. And then whenever I see a case or a challenging thing, then I make it a point to read. At that point, I may have to compromise my exercise for the next day 1 hour, because even right now I'm sitting here because I have a talk tomorrow. I'm doing that simultaneously. And lastly, very important, you need to be very systematic in your way of working. The worst thing about our medical profession is, if you see this corporate world, they will work Monday to Friday, Saturday, Sunday off. We do go for conferences on Saturday and Sunday. So where is a family life? Where is a time for ourselves? Where is a time for our passions? It's a tough call. And it's for women, it is even worse because we have to sacrifice even more. And there is no way. I mean, the world may be fighting for equality for women, but
we are having a separate episode specifically on the issues relating our lady pediatricians. Doctor, we'd like to have you back, but Dr. Neelam.
Yeah. So I think you need to make it a priority. So today I will read. So that is the way it will happen.
So Dr. Neelam, on one hand, IAP gives us a platform for academics. At the second, on the other hand, it takes away that crucial Saturday or Sunday where Dr. Santosh sir said so importantly, cuts you off from your family and social roots. How do you look at advising pediatricians to balance this?
Yeah, so as everybody has been talking, you need to actually prioritize. And to me, I mean, academics was extremely important. It was like that hunger. And when you don't have students, it's not possible. So it's always a very good idea to be in a place whether even if you're in a private sector, some part, if you're able to get into a group where there is some discussion about cases, academics, it just keeps you going and that hunger. And when you divide your work, fortunately, we become multi-tasking when we learn to do a couple of things and see. And today era, I think it's not a problem at all. With the advantage of Google, AI, etc., academics has become so easy. Think of the days when I had to spend so much of hours in the library to pull out things, to write papers. And the first 100 papers I wrote without much digital assistance. So the youngsters are really, really, really blessed to be born in this eras where they don't have to struggle so much. And it is, I always believe it's the mindset. It's all in the mind and how you need to prioritize and plan yourself. And like I always say, Arunima, who was, she had lost her legs where she was kicked out of the train in Mumbai. But then because she wanted to prove that and punish her, these people, she climbed Mount Everest, on those sticks. So I always say it's the mind over the body. If she could climb, without her feet, Mount Everest. So it's all in the mind, we can do it. Having said that, I totally agree, delegation. So for example, if I had some time at home, I was not the type who would go into the kitchen and cook for the children. I would rather want to teach or play with them. So my priority, delegation, maybe I had more staff than needed. If probably people needed to, I would end up keeping 4 because, I don't want to lose my temper and saying why this was not done, why that was not done. So always have somebody where whom you could delegate at home. And being in a joint family is wow, because I had in-laws who could give personal time to my kids, which I couldn't have expected even with the help of servants. So these things are very useful for a women worker to be with the family and have some assistance and prioritize and teach the values to the children and keep doing. So that's all I have to say.
Thank you so much, sir. Quickly from you, Dr. Amdekar, sir, how does one build in IAP into one's practice? What does IAP give you? What can you get from IAP as an academician?
I think the first thing is the time management is the essence. And therefore, I became a president when I was 54 years old. By then, my priorities of earning more patients, earning more money was not a priority because our joint practice is not me and my assistants. My joint practice we are equal. And that's the difference. So when I don't attend my regular professional work, my colleagues get more money, they get more exposed, they are happy. And then at that age, I am happy devoting my time for IAP. Therefore, I had never a problem of time management. My priority at 50 plus years, when I started doing some work for IAP, was one, keep up with academics and just see patients good enough for you to sustain good life. And let the other colleagues see the patients. So I think at each 10 years of your life, your priority changes, and accordingly, you must change your timings. And even today, I spend 1 hour for my own health in the morning with exercises. Then I never miss my eating time. I never miss my sleeping time. And even then, I have enough. When I spend 1 hour for my health, it's 4% of the 24 hours. Can you imagine? We don't have even that much time. That means you are not doing good to you. I think two things are important. If I have to do well for others, I must do first well for myself. And well means in every aspect. But once I started developing that wellness, that's the time I can do many other things. IAP has given me a lot. IAP has given me a recognition. IAP has given me, but I am never dependent on IAP. I was president in 1995, and 30 years down the line, I am still very active in academics, very active in teaching. I travel a lot to various meetings. So my priority for IAP at that time was not with the idea of getting the best out of IAP, but was trying to get something also to IAP. And that has paid me that at the end of 30 years, I'm still active the way I was earlier in academics, in teaching, and I still go everywhere, anywhere that I'm invited. So I think it's a question of how you manage time vis-a-vis your priorities in life.
Samir, are you there?
I think he's not there.
Okay, so I'll just take over in Samir. That was wonderful. And as Dr. Amdekar is highlighting, when we talk about it, I think in every doctor and every human being, I should say, should do some social work. So IAP is one platform which gives you a lot of exposure to social work too. And with me at this time, I mean, I had decided that I want to get into social work, and this was one of the best platforms you can get in IAP because it teaches you about respecting your colleagues, your friendship, and giving back to community. It is very well. Now, I think we are close to 10:30. What was the time that was set, Dr. Amol? What was the total time that we had set?
1.5 hours.
Okay, so we are almost there, and we saw that it was a beautiful show. I'm just taking over from there. And one thing which was common among all the four who spoke was all of them had very clear priorities. All of them believed in their ethics. All of them believed in quality. All of them believed in physical fitness. I've been crazy about muscle and physical fitness right from 15 years and believe in giving me time to in our own way. And as Indu was mentioning, that you need to delegate work as a woman, and that is extremely important. All of us can do. And as Dr. Amdekar said, that you need to respect yourself too if you're giving others. Believe in your me time, believe in your exercise, in your wellness too, and keep your eyes, your passion, whichever area you're working.
Absolutely.
Success is not about achieving, it is about enjoying the journey when you reach. And that's what Samir got the best out of us to say, enjoy the journey irrespective of all the panelists were from different places, but you still think all of them did well, achieved, and are happy.
Thank
So
you.
thanks to Samir.
Thank you so much,
for
Dr.
doing
Neelam,
that
for
show.
making it. We also have with us Dr. Mukul Parekh, our past president. Sorry, I didn't see you earlier there. A quick comment from you, Dr. Mukul Bhai, if you have to say about especially looking at technology and how does one take one's practice ahead.
I think whatever messages our panelists have given, especially Dr. Amdekar, Dr. Neelam, and Dr. Santosh, I think it is summarized very well. And I don't have to add anything else. But definitely by using artificial intelligence and digital platform, we know how DIP has done. And we can reach the unreached area. And best of the faculties can be available on the platform without any boundaries. So we should take advantage of that. That's about all. Thank you.
Thank you so much. Professor Dr. Srinivasan sir is here and he's one of the most avid youngsters always on the platform. A quick comment from you, Dr. Srinivasan sir.
Yeah, I have been a great admirer of all these fields because I was not I was not in private practice. I was only academician because in central government we cannot practice. But of course, I have seen Paniraman, a great ardent admirer of Dr. Amdekar, and so many others. They are doing wonderful practice ethically, and he is also very successful. And of course, I enjoyed each and every one of your comments and this thing, how you have given importance each and every aspect of practice, also the patients as well as their family, and also to your academic work and other duties.
Thank you. Thank you so much. We have Dr. Pukhraj Bafna, who is a Padma Shri, recognized by the government and all of us. Sir, quick comments from you. What our younger pediatricians should keep in mind to have a balance of practice as well as a happy life.
Samir bhai, this is all need-based and problem-oriented session. I must congratulate you. बड़े कामयाब वो अहबाब हैं जो दिल से मिलते हैं और मोहब्बतदार कुछ आसान नहीं, मुश्किल से मिलते हैं। इन सब पे मिलकर जो खुशी हुई और जो सेशन आप चला रहे हैं, it's really wonderful. And I must say, every pediatrician should learn something from this who have attended this. And for whole of the country, all the pediatricians in the country should attend such type of sessions. And the art of learning how to practice and how to live with life as a pediatrician. Thank you so much.
Thank you. Thank you very much. So finally, as we come to the end, any comments and any final messages from our guest, Dr. Amdekar sir, Dr. Professor Santosh sir, Indu, Dr. Shalini, Dr. Neelam has already summarized.
Be honest always.
Shalini, last message.
I just want to say to everyone, always remain honest to your patient and build a good relationship between your patient and with you. This is very important for pediatrician. And yes, children are definitely happy with lady pediatrician. I don't know much about male pediatrician, but you have to build that relationship. It will definitely help you in future.
Thank you so much. Dr. Indu, quick word from you.
If you follow your passion, roads open. And I
Thank you
feel
so much.
it has to be clear, and so we need to be socially active. So I have formed a foundation called Punya Karya, where I do a lot of social work. It gives you a joy of it. So
Thank you
that's
so much.
very important.
So I would say purpose would change, like social is now, integrity and compassion. These will be the three.
Yeah. Being a successful pediatrician is not a destination. It's a journey across the decade, because when you start, you usually go through that stages which you go. And basically, it's our dedication to the most vulnerable ones, what we are going to give. So the fundamentals, like what we have, like knowledge, empathy, communication, it's all remain unchanged. Even the newest gadgets come, the best thing comes, those 4 or 5 things are the most important thing. And success in pediatrics is not measured, as Professor Amdekar said, it's not by the wealth or the titles, but in the healthy smiles of the children and the trust of the family. It's very important that we have that, they go through that, because so many of us, I think all of you have that, this thing, the ones which you have seen as a kids, they have become the parents and they brought the kids to you. That is the thing when we get the maximum happiness. So finally may every pediatrician remember that in their hands lies not just the child health, but the future of humanity itself. Let's all work for them and ourselves, their families, and for a country. Thank you so much.
Thank you so much.
They invite you for marriages of the children also.
Samir,
they invite you for the marriages of the children also.
Thank you so much. Absolutely. The last word from Dr. Amdekar sir. Yes, Dr. Pukhraj.
Dr. Samir.
Hello.
Dr.
Yes, Dr. Bafna sir.
Bafna sir. Samir bhai, few more lines.
जी सर.
राहों पे नजर रखना, होठों पे दुआ रखना, आ जाए कोई शायद दरवाजा खुला रखना, और एहसास की शम्मा को सदा जलाए रखना, कुछ अपना पता रखना, कुछ बच्चों का पता रखना. Thank you.
क्या बात है, वाह. Very nice, very nice. Dr. Amdekar
बहुत
sir.
बढ़िया, बहुत बढ़िया sir.
Last words from you.
I think you must treat every patient the way you will treat your own son. And I think at the end of the day, you are only responsible for your own conscience. And even if you fail, you should not be worried about whether you did exactly what your conscience said. And therefore, you will keep in mind that every patient should be treated the way your own son would have been treated. And I think if you did that, at the end of the day, failure, success, or no success, you will still be happy because you have done to the best of your own conscience.
So, ladies and gentlemen, the art, science, and the joy of clinical practice, sustaining a good practice, is in being true to your own conscience and to follow your own inner voice. If that keeps you on the right side, you'll be all right. The moment we're finishing from today's first episode, the next episodes are all going to focus on, yes, the difficulties faced by our lady colleagues and how can we support that. Second, issues about how do you set up a nursing home. Third, the art of negotiation in difficult situations, maybe with stakeholders, with patients. There is going to be an episode on how do you manage medical legal issues. There will be an episode on the art of presentation in a clinic. So keep watching this space for every Wednesday evening as we bring you Smart Pediatrician with Dr. Samir Dalwai on the Maharashtra IAP platform. And to conclude today, yes?
Dr. Samir?
Yes?
Only
Yes.
one line. I am Dr. Prem Singla for Panipat.
Yes, sir. Yes, sir. Go ahead.
You are to be a good human being, to be a good doctor, to be a good teacher, to be a good technician. So good human being is a must. Being a good human being is a must to be a good doctor.
Absolutely, absolutely. We'll end on that. Dr. Amol, over to you. And we are going to conclude the session with words from the secretary. Thank you so much
Thank you.
to all the esteemed guests today who came on this show. And thanks to all our IAP members who attended today. We'll come back to you next Wednesday. Dr. Amol.
Yeah, thank you, Dr. Samir sir, for guiding every one of us. And it was very skillful discussion, and you have kept all the panelists on track and every attendee also. So there were almost more than 500 attendees on Zoom, and many of us were there. Many of them were on YouTube also. I thank all the panelists, expert panelists, respected Dr. K Amdekar sir, respected Dr. Santosh T Soans sir, our President-elect ma'am, Dr. Neelam Mohan ma'am, then Dr. Shalini ma'am, and Dr. Indu Khosla ma'am. I also thank all the stalwart attendees, Dr. Pukhraj Bapna sir, Dr. Bodhankar sir, then Dr. Rajesh Chokhani sir, MS Vishwanathan sir, and Dr. Bakul Parekh sir, and all the attendees from Dr. Srinivasan sir, our Sanjay Pakmode sir, and everyone from all Maharashtra IAPians, all the office bearers, and various attendees from across. Dr. Sitaraman sir was there, Dr. Satyendra sir is there. Then many of the stalwarts, pediatricians, academicians, they attended this session, and this session was very useful for all the pediatricians who have various concerns about their practice, about their setup, and how to move ahead in their practice. So it was a very wonderful session, and this is very smart move. This is very innovative program you have came up with to MahaIAP, and
thank you.
From for all the attendees, it will be a it will be every Wednesday program. So 2-3 days before the this actual session, will be forwarding the flyers and the topics and the panelist names and all these things. So you please kindly be there with MahaIAP and with Dr. Samir Dalwai to be smart pediatrician. Thank you.
Thank you so much. Thank you so much. That's very nicely said.
Yeah, thank you for the wonderful program. It was really nice.
Thank
Thank you, sir. Sir, thank you so much for giving me this opportunity. Thank you, sir.
Thank you so much.
Good night, all of you.
Thank you.